Hi, my name is Paige and I'm the nurse today. I will be working with Mr. Jones, and after reviewing his lab work and his orders, the doctor has ordered 2 grams of Rocephin to run over 30 minutes. Rocephin is an antibiotic that treats bacterial infections. It works on the cell wall and kills the cell. A safe dose of Rocephin is 1 to 2 grams every 12 to 24 hours. After reviewing his lab work, his white blood cells were high, and I also checked his bun and creatinine, and because you're supposed to watch Rocephin for people who have renal failure. He has no known allergies, and Rocephin is known to have hypersensitivity to patients with allergies to penicillins as well as cephalosporins. Some side effects of Rocephin is rash, diarrhea, as well as anaphylaxis. So I'm going to go ahead and start and get everything prepared before I go into his room. Right here we have the Rocephin, and it is available as 1,000 milligrams per milliliter. No, that's correct. And so I'm going to go ahead and pull up 2 milliliters of med, as the doctor has ordered 2 grams. So I'm going to go ahead, hand hygiene, put on some clean gloves. Also, the medication will be running at 17 drops per minute, and I will show you my math once I'm done preparing the medication. So first off, we're going to take the medication bottle, clean the top, get my needle ready. Need 2 milliliters. Inject it with air. Alright. I'm going to go ahead and inject the medication into the saline bag. Alright, and this would then go into the sharps container. Alright, I'm going to go ahead and label my bag with the drug, the amount, the date, the patient's name, the time, and my initials. And he also needs to have IV tubing. So I'm going to go ahead and prime this, as well as label the tubing with the date, the time, and my initials. Go ahead and I'm going to spike this bag. Fill up the chamber. Now I'm going to undo the wheel and wait for it to drip out. Alright. No signs of any air bubbles. Alright. And here's the math that I have come up with to show you that it is 17 drops per minute. It is a 10 drop per 1 milliliter IV tubing, and it's 50 mils over 30 minutes, which is 500 divided by 30, which equals 16.6 drops, which rounds up to 17 drops per minute. Alright, now I'm going to go ahead and I'm going to remove my gloves. I have a pre-filled saline syringe ready that I will take into the patient's room. Alright, and I did check the expiration dates on both the Rocephin and the IV bag, and they both expire in 2020, so we're good to go. Alright. Alright.
Hi, my name is Priscilla Prieto. I'm an intern student in section 11.
Hello.
Oh, hi.
Hi, Mr. Jones. I'm Paige. I'm going to be your nurse today. The doctor's ordered for you to have some Rocephin put into your IV. It's for your, it's an antibiotic. Your white blood cells were a little high, which indicates that there could be an infection, so we're going to go ahead and give it to you prophylactically. Is that all right?
Yeah, that's fine.
All right, hand hygiene. Put on a new pair of gloves. Can I get you to state your name and date of birth?
Mr. Jones, 11, 12, 85.
Do you have any allergies, Mr. Jones?
No.
Alrighty. I see no redness, no inflammation. Is this tender at all?
Nope.
Alrighty. I have my saline as well as my alcohol prep. I'm going to clean the port. Alright, and then I will aspirate for blood. There's blood return, which indicates that the IV is working. And I will do the push-pull step by doing a half ml of saline to indicate that it is working. And it is. Alright, so now I'm going to go ahead and I'm going to hang the mini bag of Rocephin. The tube has previously been primed in the med room. So and it is priming again, so we are good to go. I'm going to remove the cap, and I'm going to get another alcohol prep, clean the port, then I'm going to go ahead and insert it. Alright, and then the drip factor was good, which is 17 drips per minute, and I will release the wheel. And as it is flowing into the patient, are you having any issues? Are you comfortable, Mr. Jones?
Yeah, I'm good.
Alright, good. I am assessing the site. There's no rash, no signs of redness, no signs of infiltration. And then this time I would lower the bed to the lowest position. Mr. Jones, do you use the restroom?
No thanks.
Alrighty. Can you rate your scale on a scale of 0 to 10?
Oh, it's like a 1.
Alrighty. And then I would move over all of his personal belongings to his bedside. And then I would go take my gloves off and document the time that I hung the bag, as well as the date, my name, and the site that I put the bag in at the IV, as well as the route and the dose, as well as the medication name. Thank you. Hi, my name is Paige, and I am Miss Smith's nurse today. And after reviewing her MAR, the doctor has ordered some vancomycin. She wants 1 gram over 30 minutes to be run via piggyback. So, vancomycin is a antibiotic. It binds the bacterial cell wall, resulting in cell death. A safe dose is 500 milligrams every 6 hours or 1 gram every 12. Some nursing interventions that need to be done are checking the white blood cells, albumin, do a complete urinalysis, and checking the kidney function by drawing blood and creatinine labs. Some contraindications for vancomycin are patients with renal impairment as well as intestinal obstruction and any sort of hearing impairment. Some main side effects and adverse reactions are ototoxicity, anaphylaxis, nausea, vomiting, hypotension, and rash. I'm going to go and check the MAR again because the doctor has ordered 1 gram over 30 minutes, which is a safe dose. So we're going to go ahead and give 1 milliliter of drug. It is 1 gram per every milliliter, so we're going to have to draw up 1 milliliter of that drug. The drop factor is 17. The way I got that was with a 50 milliliter piggyback to be run over 30 minutes, and 500 divided by 30 is 16.6, which is 17 drops rounded up. So I'm going to go ahead, hand hygiene, put on some clean gloves to prepare my medication. I'm checking the bag, and it is not expired, expires 2020. Also, I've checked the vancomycin, and it is not expired. This also expires in 2017. I'm going to go ahead and I'm going to clean the top of the Vanco with an alcohol prep pad. I have my 10 milliliter needle. I'm going to pull up 1 ml of air, inject it into the medication, pull up 1 milliliter of drug, then I'm going to go ahead and inject it into the piggyback. Alright, and then the needle would then go in the sharps. Alright, at this time I would label my bag with the client's name, the drug, the dose, the time, and date of the administration, as well as my initials. I need to prepare the tubing. So right here we have the tubing. And I would go ahead and start off by labeling this with the date, the time, as well as my initials. I'm going to go ahead and spike the bag. I need to prime this tubing to make sure that there's no air bubbles. I'm going to go ahead and I'm going to open the wheel. And it is dripping out. Everything looks good. There's no signs of air bubbles. Go ahead and clamp it back. I want to make sure that I have everything ready to go before I go into Mrs. Smith's room. She has no sign or history of allergies, so once we go in there, we will reassess. I have everything. All right, I'm going to take my MR. I'm going to go ahead and remove my gloves. I removed them.
Come in.
Hi, Miss Smith. I'm Paige. I'm going to be your nurse today. How are you doing?
I'm good.
All right, and at this time, I would perform hand hygiene and put on a new pair of gloves. Miss Smith, can I get you to repeat your name and your date of birth?
Mary Smith, 18/12/85.
Alrighty, and your birth. Oh, you already told me your birthday. Are you allergic to anything?
Nope.
Alrighty, and how is this IV doing? Is there any tenderness?
No, it's okay.
Alrighty. At this time, the IV is already unclamped. We're going to be hanging a mini bag of vancomycin. Your white blood cells were a little high, so the doctors ordered for you to receive an antibiotic. Alright?
Okay.
So first I'm going to drop the bag. And then second, I'm going to go ahead and hang this up, the Vanco. The protective tubing is still on. So, and here's the main port. I'm going to go ahead and I'm going to clean that with an alcohol swab. And I'm going to remove the tubing, connect it. Then I'm going to open the wheel and allow it to drip at 17 drops per minute, like we had discussed earlier. Alrighty. And it is running perfectly. Alright. Miss Smith, are you alright? Are you in any pain?
Oh, I'm good.
Alrighty. Do you need to use the restroom?
Nope.
Okay. Here's your glasses. I'm going to lower the bed to the lowest position, side rails up. Miss Smith, if you need anything, just make sure you use the call light so that I can help you get up and use the restroom safely. I would then leave the patient's room, remove my gloves, hand hygiene, and document the time, the date, the medication, the dose, the route, the frequency of the vancomycin that the doctor had ordered, and also document that the patient had no issues receiving the medication or anything. I would go back and within the hour and check on her to make sure that everything is okay. I would be back in 30 minutes because that's when the bag would run out.